Len Bruce, Executive Director of Medical Services, Murrumbidgee Local Health District. Good afternoon, everyone. Welcome to the Murrumbidgee Local Health District COVID-19 update for the 21st of October 2021. Firstly, this afternoon, we are sad to announce that there has been another COVID positive patient who's passed away in the Murrumbidgee Local Health District. We extend our condolences to the family of the patient, as well as the staff who looked after them, and also to the greater community. There is also 51 new COVID cases up till 8 p.m. last night, and 48 of those cases come from the Albury LGA, 2 from Edward River, and 1 from Greater Hume. Currently, there are 2 COVID positive patients admitted to Wagga Base Hospital with no patients in intensive care. The current outbreak has now reached 183 cases, where the majority of the cases come from the Albury LGA. There's also some cases from Hilltops and Edward River and Greater Hume. What is new is that we don't report recovered cases because the assumption is that after 14 days patients have recovered in terms of their ability to infect other individuals with COVID-19. The great news for us is the high vaccination rates in the Murrumbidgee Local Health District. And currently, for us, 91.3% of eligible people have had 1 dose, and 71.9% of people are totally vaccinated. Albury is actually even better than the average, and in Albury, 94.6% of eligible people have received 1 dose, and 72.5% have received their second dose. So it's really exciting for us because we want to be as vaccinated as possible. And if we think that we're over 90%, we can expect that within the next 2 to 3 weeks, more than 90% of eligible people in the Murrumbidgee Local Health District will be fully vaccinated against COVID-19. It is important that we extend the correct messaging about third doses, and it's not really a booster dose. It is just there are certain patients who, for various reasons, have an immune response that is not as effective, and they may require a third dose to make sure that they get the same level of protection as other individuals, and that will be the group where we will start providing third doses at this time. Now, there's quite a number of exposure sites that are being listed, and I would advise everyone to go to the New South Wales Health website, where you'll provide details of exposure sites and also with appropriate advice for those areas. We know that as part of this outbreak, there has been cases in a residential aged care facility, and I can ensure the community that that is being managed as per the facility's outbreak management plan, with the support from the Commonwealth and also the appropriate local health district, whether or not it be Murrumbidgee or Albury-Wodonga Health. There are cases in schools and early childhood centres, and once again, those particular outbreaks are managed in a collaborative fashion between the local health district, the Department of Education, and the facility. And once again, you know, the pupils and the staff and their families have been contacted, so they are completely kept in the loop. What is not surprising is that most of the new cases are in the sort of younger age group, and I would like to extend a call to arms to this group. If you're over the age of 12, you're eligible for a COVID-19 vaccine. Go out and get vaccinated. And the reason why you should get vaccinated is twofold. Firstly, it is to protect yourself, and even we know that younger individuals are less likely to develop severe symptoms from COVID. We do know that some young people become severely unwell, and some of them even pass away. So you'll be protecting yourself against the complications of COVID and also to the potential effects of so-called long COVID. The other important reason why you should get vaccinated is that if you're vaccinated, you are less likely to infect other individuals, so you'll be protecting yourself and you'll be protecting the community. So please go out and get vaccinated. The other important tool that we have to protect ourselves is with increased testing, and the Albury community has been magnificent. We're doing more than 1,000 tests a day. So if you've got the mildest of mild symptoms, please go out and get a test and isolate until you've got your result back. Any questions?
So with the increasing cases in Albury, people there are being encouraged not to leave the LGA and to restrict their movements. Would the same be said for people in Wagga and other areas in terms of going into Albury?
So we know that there is currently community transmission in the Albury LGA. So it would be, prudent to avoid travel to that area to essential travel, especially if you're not vaccinated. So, we would advise people to reconsider if they have to go there. You can still go and you can protect yourself by making sure that you're vaccinated, wearing a mask, doing appropriate hand hygiene, practicing social distancing, but it's probably not advisable to go for a recreational trip to that particular area at this time.
And with the cases in aged care in Albury, has there been any changes to how the MPSs across the MLHD are operating in terms of any increased restrictions or measures taking place?
So the facility where the outbreak is obviously locked down, but in terms of the other facilities in the Murrumbidgee Local Health District, we just follow our standard process at this time.
And with the increasing cases with the 12 to 24 age group, what sort of action should be taken, and should people in Wagga be concerned that their kids could potentially catch and spread COVID?
The fact that there are more cases is not unexpected. All right. We knew that once the public health restrictions were eased and people interacted with one another in a more what is considered normal fashion, that there would be an increase in case numbers. But what is now completely different is the fact that we have increased case numbers in a vaccinated population. So my advice to anyone is, if you have a child over the age of 12, please go and get them vaccinated. If you have concerns about them being vaccinated, speak to your doctor. But the best way for us to protect our children and the community is for people to get vaccinated.
Would you say that the increase in cases among that younger age group is maybe a sign they're not as vaccinated as the rest of the population is?
I don't have the exact numbers for the vaccination percentage in the younger age group, but we know that the older you are, the more severe your risk is in terms of developing severe COVID. So clearly our vaccination priority was initially focused on the more mature age group, but we would encourage the younger groups to go out and get vaccinated. And I think if we go and look at Albury in general, they're almost 95% first dose, which is excellent. And that's really where we want to be. We want to be as close to 100% as we can get, because that is our best protection against COVID.
How with the age demographic in Albury, as you said, a lot of the cases are 12 to 24-year-olds, and we have had quite a few schools closed in Albury. Do we know how many students have tested positive to COVID, or how many of today's cases were students?
Unfortunately, I don't have that detail. I just have the number of cases.
Could you give us a rough breakdown of positive cases by age demographic? Is it like a large majority of younger people, or?
Unfortunately, I don't have. We know that the majority of cases are 12 to 24, but I unfortunately won't be able to give you an exact number.
As majority, would that mean over 50% of today's cases, or just?
Yeah, it's difficult to say.
Yeah. Because we do have lower vaccination rates than obviously those areas like Sydney and everything, and lockdowns aren't seeming to be a thing anymore. Are we worried with the growing outbreak that there won't be any lockdowns, and do we think we can stop the spread of these cases?
I think lockdowns was a strategy before people were vaccinated. We were essentially faced with a very infectious virus that caused severe illness in still a relatively small number of patients. But now we have very effective vaccines available that makes it far less of a severe illness. And we need to understand that lockdowns also have an opportunity cost. It's not that a lockdown happens in isolation and there's no impact on the community on a broader scale. Now, whether or not there may be limited restrictions in specific groups, that may be required, and we'll leave that to the public health response and also to the New South Wales Department of Health. But the Murrumbidgee Local Health District position is that it's about vaccination and, keeping our community safe, preventing people from becoming unwell, that they, require hospital admission or even intensive care unit admission. And we now have a very valuable, defence against COVID with vaccination.
You mentioned 51 new cases and 48 in Albury. How many of these are linked or under investigation?
Currently, those cases are under investigation, and the public health unit should be able to provide an update in terms of, cases that are linked, but I don't have that information at this time.
So do you know how many were infectious in the community?
No, not at the moment.
And can we ask you any closer to finding out the initial source of the infection, both in the community and in Mercy Place?
Yeah, we don't have the details of the index case. What I'd probably suggest is we can take that on notice for the public health unit when they do their regular press conference and see if they've got that information. It can sometimes take quite a bit of time, especially when there's less restrictions on movement in terms of, who people have interacted with. So it can take time to identify the index case.
Can you give us any information on the second death at Mercy Place?
Now, all that I know, it was someone who had underlying health conditions, but that's all the information that I've got at this time. The only addition is that death was not reported in terms of the statistics that's published today, because it happened after 8 p.m.
You're working closely with the New South Wales early learning sector to manage current outbreaks. Is it children at these centres testing positive? And what's the concern if they are young?
We know that young children does not seem to be as severely affected with COVID as people that are older. Obviously, in any facility where there's a large number of people, whether or not they're children or adults, there's a risk of cases spreading between pupils and also to their families and then to the broader community. But once again, we are very experienced in managing infectious diseases in childhood centres. As someone who has kids in daycare, it's something that happens, and it's not unexpected or surprising that you may get children that become unwell. I think the important message is that if your child is unwell, please do not send them to daycare. I think that's the message for us. And whether or not it's COVID or another respiratory illness, the messaging remains the same. We know that it is difficult, if you have children that develop respiratory illness, but please follow the safe thing. The same that the advice is, if you're sick, don't go to work. Go and get a COVID test and isolate until you get a negative result.
You mentioned vaccines. Are you concerned about the low level of vaccinations in the Edward River local government area?
I don't have the exact numbers, but if we go and look for the Murrumbidgee Local Health District at the moment, I think we're quite comfortable, and what you'll find is that the rates will go up, significantly, and there's, so many vaccines available now, so many opportunities. We just need people to do the right thing and make use of those opportunities.
Would you send the mobile van to Edward River or to Albury to help out?
Our team will, provide support wherever it is required, and what we do is we would normally collaborate with local providers and see to make sure that we don't double up unnecessarily, but that is being managed by the MLHD COVID response team.
Can our health system cope with such a high number of cases that you're worried about tomorrow and the next day?
I'm confident that we can manage a COVID outbreak in a vaccinated population. It would not be unexpected for the cases to increase, tomorrow. And I'm confident in the systems and processes we have in place that we can manage that as appropriate. We have good systems in place to look after patients. We have enough capacity in the hospital. But once again, the proviso for that is that we need, really as many people as possible to be vaccinated.
You mentioned vaccination rates and you mentioned lockdowns. Should all we go into a lockdown with such a jumping number of cases?
That is something for the Public Health Unit and the Department of Health to decide on. I don't have the exact details of how many people were infectious in the community or linked to known contacts. So we'll leave that to the Public Health Unit and the Department of Health.
Do we know what the vaccination rates of that 12 to 24 age demographic in Albury is?
Unfortunately, I don't have that detail. We can take it on notice. We may have that available, but I can ask our team to see if they've got that information for you.
Do you think it would be a possibility that because they were one of the last demographics to have the vaccine available to them, maybe the rates are a little lower and that's why the cases are majority that age?
Yeah, I think though that the 12 to 24-year-old are probably the more social demographic group in the population. And once again, as I mentioned before, is that we prioritised vaccination to the groups that were at most risk initially, and that's why we started with the aged care residents. But now there's so much vaccination opportunities that it should not be difficult for the younger age group to make sure that they get vaccinated as well.
Do we know how many younger people have tested positive?
I don't have the age group of the exact age group of the cases that tested positive, but it wouldn't be unexpected if there was some children and adults in that group.
In Albury, the entertainment centre there was listed as an exposure site on October 17, and then the next day hundreds of people went through to get tested at that site. Is there any concerns that it may become a super spreader event?
No, so that area was listed in error, and you'll see that if you go and look at the New South Wales Department of Health website, that area has now been removed.
Okay.
Yeah.
So it wasn't an exposure site?
Not with the information that has just been provided to us, no.
No worries. And how long does contact tracing typically happen from when a positive result is returned?
I think part of that will depend on the number of interactions by the individual, so it's very difficult to give you an exact figure, but what we can do is we can probably take that on notice for the Public Health Unit and they'll be able to provide that. But it would really depend on the number of cases in the community and also your number of interactions.
And in Albury there's been quite a few instances of shops sort of self-identifying as exposure sites.
Mm-hmm.
Do you think that contact tracing is able to keep up at the moment with the increase in cases?
So the process has obviously changed that quite a number of exposure sites is now essentially automatically listed. And what we do with contact tracing, it is more focused on particularly high risk areas. But I think that's why it's important for all of us to make sure that we keep checking the website, because there's always sites that will come up and a sensible approach is to keep an eye on that. But in terms of a practical advice, it really is about if you have the mildest of symptoms, go and get tested and isolate until you get a result. Because unfortunately, if we look at the history of cases, there's been quite a number of people that have waited quite a long period before they get tested. And remember, as I've mentioned before, is that the reason why we want you to go and get a test is that if you qualify for therapy against COVID-19, is that we can make sure that you get it in an appropriate time. But if you wait too long after you become symptomatic, that option may become less available to you.
And in Albury, there's around 10 schools that are linked to cases,
Mm-hmm.
and of course we've talked about the younger age group having the majority of cases today. Is there any case to be made that schools should close?
At this stage, we will follow the advice from the Education Department and New South Wales Department of Health. But part of our process in living with COVID is to manage it, and lockdowns will become, far less prevalent. And once again, as I've said before, lockdowns come at a price too. So once again, that is something that will be considered on a case-by-case basis, and it may be required if that's felt to be the best strategy at the time.
And what advice would you give to parents in terms of how they can best keep their children safe from COVID during this time?
Yeah, so, well, if your child's over the age of 12, get them vaccinated. If your child is unwell, please don't send them to school, and make sure that they get a COVID test.
And how is the MLHD coping with this increased testing uptake and the demand for testing?
It does require, a significant amount of our resources, and we've obviously reallocated resources, but I'm very proud to say that the staff is actually, really stepping up, as they've done, over the last, almost 2 years now, and people are chipping in to help out. So we're managing it, quite comfortably at the moment, and our testing capacity is such that we can manage the increased number of tests that are required. I must point out, though, that there's obviously significant support from other providers as well, especially from the private providers, and we're very thankful for their support in helping us managing this current outbreak.
And is the MLHD concerned that the outbreak in Albury may spread into rural communities in Federation and the Greater Hume LGAs?
Well, we are concerned, and that is why we're asking residents of the LGA where there currently is community transmission to limit their travel to other areas to only essential travel at this time, especially until we can get a better understanding of the exact magnitude of this current outbreak.
And just last question from me. Is the MLHD aware that there are 2 churches in the Greater Hume LGA that are spreading anti-vax messages? And if so, is there anything being done to counteract this?
I'm not aware of that information, so I can't comment on that. But the medical advice, internationally, nationally and locally, is that the best protection against COVID is vaccination. We have 3 very effective and very safe vaccines available currently in Australia, and we know that it's effective. It, prevents transmission, it prevents severe illness, it prevents hospitalisation, and it also prevents admission to ICU and death. And the best way to contribute and keep everyone safe, to allow us to have services available for people who don't have COVID, is to go and get vaccinated.
Do we know where the initial case came from?
At this stage, not.
Do we know what the rough breakdown of the vaccination status is of the current cases?
Unfortunately, not at this time.
And do we have any idea of the source of the infection at the Mercury hospital?
No, unfortunately not at this time.
And I believe residents at the Mercy Place residential home are in their own rooms, isolated. Do we know how long that'll go on for?
That will be determined by the group that's managing the outbreak management plan. We'll obviously try and do it as short, for as short a period as possible.
You mentioned outbreak management team. Are they in each local government area, or that's something run by the Murrumbidgee Local Health District?
No, so each facility has to have a outbreak management plan for a particular facility, and that is supported by the Commonwealth and local providers. So I can't comment on other local health districts, but we have a plan in place for every facility, and we allocate resources to the facilities as required, but it really is a multi-agency response from the Commonwealth, the local health district, and also from the state health department. Beautiful.